On March 23, 2010, President Barack Obama set in motion the radical remaking of America's healthcare system by signing the Patient Protection and Affordable Care Act into law. 3 years later, the law's implementation is well underway. But to fully grasp what's ahead, we must take stock of what the law has already done, what Congress can do now, repeal parts and delay, and what a future replacement agenda would look like. Federal bureaucrats began implementing the 2,700-page law soon after President Obama put pen to paper. By 2013, they'd issued 20,000 pages of regulations, and it's still rising. Starting in September 2010, all family policies were required to cover children up to age 26. Another mandate began restricting insurance companies from placing lifetime limits or annual caps on the amount of coverage a customer could consume. Insurers were banned from denying coverage to children with pre-existing conditions and prevented from charging for anything that the federal government categorized as preventative care, things like contraceptives and mammograms. While these rules are popular, they've made coverage much less affordable. Already, insurance premiums have risen by an average of $3,065 since President Obama took office. This contradicts his promise that under the new law, the average family would see its premium decline by $2,500. And in 2014, many of the most revolutionary provisions of the new law will come online, including a massive expansion of Medicaid, the joint state and federal health program for low-income Americans and seniors who are disabled or poor, subsidies for those earning between 138 and 400% of the federal poverty level, the employer mandate, which orders nearly all firms to furnish coverage to their workers, the individual mandate, which requires nearly all Americans to secure health insurance or pay a penalty, and several major regulations that will drive up the cost of insurance for virtually everyone. According to CMS, health spending will rise by 7.4% and account for 18.2% of GDP by 2014. By 2050, healthcare could consume 40% of our economy. This is why the House of Representatives has voted to repeal Obamacare more than 38 times. But if repeal comes about, our leaders must have a replacement agenda ready. And here's what should be in it. Congress must reform the federal tax code so that individuals can purchase insurance in pre-tax dollars in the same way that employee-based coverage is purchased. To make coverage more affordable for individuals who don't get coverage through work, Congress must institute a refundable tax credit to help offset the cost of insurance. They should expand the availability of health savings accounts. Doing so would encourage Americans to shop smartly for their care, as they'd be spending their own money. It would also lend to transparency in healthcare pricing. They should allow the purchase of insurance across state lines. There's no reason that insurance policies issued in Rhode Island should cost 2.5 times what they do in Alabama. For those who cannot afford coverage because of pre-existing conditions, the Fed should seed a robust network of high-risk pools at the state level. Such pools were functioning well in many states before Obamacare, delivering coverage to those who needed it most without raising premiums for everyone else. They should scrap the expensive mandate forcing doctors and hospitals to set up electronic health records. The average initial cost of an electronic health record system is $44,000 per physician, with ongoing maintenance estimated at $8,500 per year. Those costs are passed on directly to patients. And states should reform their medical malpractice laws. Each year, more than $100 billion in healthcare expenditures is driven by concerns from the healthcare providers about medical liability. Bringing some common sense to our malpractice system would reduce those wasteful expenditures and usher in lower costs for patients. The next president will have the chance to repeal Obamacare and to replace it with real healthcare reform. If they don't, Americans will find themselves on the road to serfdom, and there may not be an off-ramp.